So pharyngeal apparatus deals with structures that are going to give rise to the head neck, structures in the head and neck. That's the part that you are dissecting right now. We'll try and find some correlation. Most of the times I start the embryology class with this only, every time in fact. We have had embryology classes before between us, so I am sure you know the technique of answering an embryology question. Anyone wants to tell us, tell the house, how do you answer an embryology question that is asked for 5 marks, SAQ? Germ layer of origin, very good. Duration, time when the structure starts developing. Certain terms that are used in the development of the structure. Then what else? Then obviously when it begins developing, it will progress developing. So there are stages which it will undergo. So stages of development, and finally it will reach to its state. That's the final state of development. And if something goes wrong, it leads to anomalies. So embryological basis of anomalies. So these are the points that must feature in any embryology question. Even if the question says, explain the embryological basis of. So if you explain the embryological basis of a congenital anomaly, firstly you will have to write what is normal. Same applies to write applied anatomy of, if that is a question, or explain anatomical basis of a particular disease. Do not forget to write normal anatomy. If you are asked an SAQ, explain the anatomical basis of inguinal hernia, and you say, define inguinal hernia, and say that there is a defect which is enlarged through which the contents just protrude out. That is the anatomical basis. The defect is enlarged. And you say, the question was explain anatomical basis, I will have to be given 5 out of 5. That is not done. Okay. So the term explanation has got a lot of weightage. Explanation of abnormal always is with respect to normal. You will say, normal anatomy was not asked in the question. So I have written up to the point. But the point is explain. Okay. Have you fit that into your mind? Okay, and then you come to us, no? Hurry, I have got only 1 mark. Teacher has given only 1 mark. This is the reason. Okay, so as you rightly said, 5 points. Primordial terms, germ layer of origin, time, size of the embryo when it starts developing, stages of development, and applied embryology. Competency. What competency are we referring to when we are discussing pharyngeal apparatus? So 43.4 as per the competency booklet, it states that describe the development and developmental basis of congenital anomalies of face, palate, tongue, branchial apparatus, pituitary gland, thyroid gland, and the eye. I have highlighted things with different colors. What it means. Face and palate will be discussing on 2nd of June. Branchial apparatus is an equivalent name for pharyngeal apparatus. That is what we will be discussing today. As a part of the development of branchial apparatus, we will also be discussing development of tongue and thyroid gland, time permitting. Otherwise, if I ask you, what is tongue? What is the answer to this question? What is tongue? It is a muscular organ present in the oral cavity. That is the answer to the question, what is tongue? What type of organ is tongue? Muscular organ? What is the function of tongue? Can't hear anything. Tongue helps in mastication, mixing of fluid, deglutition, formation of bolus. Tongue is used for expressions. when you bite your tongue, that's an expression, right? And tongue biting can be done in different ways. Come to the point, what is the main function of tongue? So tongue is a muscular organ, but it's a sensory organ. What kind of sensations? General or special? So tongue, though it's a muscular organ, anatomically, functionally, it is a sensory organ carrying special sense of taste. That is why the tongue exists. So therefore, even if we don't discuss development of tongue today, there will be a separate lecture on embryology of special sensory organs. That time this will be discussed. Same thing, thyroid gland, which we will be dissecting next time. Thyroid gland, subclavian artery, deep structures of the neck. Next 2 sessions we will be dissecting. What is thyroid gland? What is the answer to this? Mind you, I am not asking define thyroid gland. So I am giving you the liberty of answering in your own words, what is thyroid gland? And to give you more liberty, what according to you is thyroid gland? The thyroid gland is an endocrine gland. Okay. Where it is located? In front of thyroid cartilage in the neck. It is located in the neck. Very good. So endocrine gland located in the neck is thyroid gland. Very good. Endocrine gland. That is the key word here. So even if we don't discuss thyroid gland development today, there will be a separate lecture on embryology of endocrine glands or system. It will be discussed there. Okay, and eye of course is special sense organ, so special senses, pituitary gland is endocrine gland. That's why, that's the explanation of different colors of the font. So what I will be covering in this class is derivatives and anomalies of pharyngeal arches, pharyngeal pouches, pharyngeal clefts and pharyngeal membranes. These 4 constitute what is called as pharyngeal apparatus. Development and anomalies of thyroid gland and tongue. This is what is the plan. So under this, learning objectives that you will all be able to achieve by the end of today's class is you will be able to list the derivatives of pharyngeal arches. Simple list. 1, 2, 3, 4, 5, 6. List. List the derivatives of pharyngeal pouches. List the derivatives of pharyngeal clefts. List the derivatives of pharyngeal membranes. So remember, there are 4 lists. What is the moral of the story? That from this lecture, there are a lot of recall questions that will come. You will have to reproduce, recall, listing. If you are asked, list the derivatives of first pharyngeal arch. So you will have to start listing them. Specify the embryological basis of anomalies of pharyngeal apparatus. So that means anomalies of pharyngeal arches, pouches, clefts and membranes. Specify development and anomalies of thyroid gland and of the tongue. So let's now throw light on the various terms that relate to pharyngeal apparatus. Arches. Why arch? Because of the shape. You have seen in general embryology, you have seen the model of a folded embryo. Have you all seen? In the folded embryo, there are various stages. And in one of the extreme stages, there are a few swellings that were seen on the cranial end of this folded embryo. Those swellings are arch-shaped, which are from the dorsal aspect to the ventral aspect. So they are masses of mesoderm which are shaped like an arch. That's why it's called as an arch. What the meaning? Arch. Pouch. Pouch means there is some bag-like structure, pouch. But this pouch is on the internal aspect of this arch. So if the arch is like this, whatever is lying within is a pouch. Whatever is lying outside is a cleft. But is it parallel to the arch? No. In between the arches, in between the solid masses of mesoderm, there are grooves. A groove within and a groove outside. So the groove within is referred to as a pharyngeal pouch, like this here. and the groove outside is referred to as a pharyngeal groove or cleft. Now, why pharyngeal? Because that is another term, pharyngeal. Why pharyngeal, why branchial, why visceral, why gill? Pharyngeal because the structures derived from these arches, pouches, clefts are all concerned with or around the pharynx. If I ask you, what is pharynx? This is elementary knowledge, right? Bachcha janta hai what is pharynx. So what is pharynx? Yes? बच्चा जानता है, हम सब तो एडल्ट्स है. Tell, what is pharynx? In layman's term, what is pharynx? Connection between oral cavity and esophagus, that is the layman's term for pharynx. Okay. When you suffer from common cold, one of the symptoms is running nose, watery nose. The other symptom is pain in the neck. But when we say pain in the neck, we don't go and complain that I have pain in the neck. What is the complaint that we make? Gala, barabar. Gala and neck is same, no? So the word is throat. Correct. Throat. Sore throat. Sore throat. So throat is the layman's term for pharynx. So therefore here pharyngeal refers to structures of the pharynx and around the pharynx. So pharyngeal. Now why branchial? Branchial. Any idea? Branchial. Branchia. Human beings have evolved from lower animals. Pharynx, equivalent of pharynx in lower animals. Now which lower animals are we talking about? You hit the nail on the head. Fish, correct. So branchia means the gills of fish. Gills. Therefore branchial arches. Visceral. Why visceral? Pharynx is an organ. Correct? Structures within the neck, not in the wall, are all visceral. So therefore, the derivatives of these arches and pouches and etc. are actually dealing with organs. So therefore, visceral arches. And gill and branchial are synonymous. Gill arches or branchial arches refer to its derivation from its role in fishes. Clear about the terminologies? Because that's the root of this, or essence of this class. If you are aware of the terminologies, very simple, rest all is simple. Why this particular diagram? It shows a folded embryo, these swellings are pharyngeal arches, the grooves which are seen outside, this is pharyngeal cleft, and this is a section which is passing through it, plane of section. So this is what will be seen in that section. So this is coronal section. So this will be outside, this is inside. This is cranial, this is caudal. So coming to the folded embryo. Folded embryo at 24 days, which means which week? 4th week. Barabar hai? This is beyond that, towards the end of the 4th week. So at the beginning of the 4th week, you can see that, okay, हुआ इसका बैटरी गया है, लाल हो गया था बीच में. So this is one appearance of the pharyngeal arch, and there are multiple then. You know what is blastula? Blastula. Which stage of the embryo is called as blastula? When the embryo shows appearance of the blastocyst cavity. And the cells are called as blastomeres. That's called as blastula. That stage is called as blastula. Morula followed by blastula. Which stage is called as gastrula? When the third germ layer starts appearing, the embryo is called as, a stage is called as gastrula. Which stage is called as neurula? When the differentiation of surface ectoderm happens into surface ectoderm and neurectoderm, and the neurectoderm gets modified to form groove and then tube. That is the stage of neurula. So along these lines, there is a stage called as pharyngula. So this stage is called as pharyngula, when the pharyngeal arches start developing. So where do these appear? They appear towards the cranial end of the embryo, just behind the brain vesicles, and they are in between. This is precordial or the pericardial bulge here, and this is the head fold of the embryo. So this is where it is developing. So this is which part of the gut then? The part of the gut that lies in the head fold is called as? It's called as foregut. So the cranial part of the foregut is where, around which these mesenchymal bars or mesodermal bars start appearing in the form of pharyngeal arches. So these are pharyngeal arches in this picture. You see all this yellow is gut. This is foregut, this is midgut, and this is hindgut. What is this diverticulum? Allantois diverticulum. Correct? So it's the cranial part of the foregut around which these pharyngeal arches start developing. And where it opens here is in the stomatodium or stomodium. So if we take a section passing through the pharyngeal arches like this is how it will appear. This is cranial and this is caudal. So this is where stomatodium will be there. So this mass of mesoderm which is forming the core here is called as an arch. Likewise, now if you see, there are 6 pairs of arches that develop. Out of the 6 pairs, the 5th one disappears. So finally what remains is 5 pairs of arches, but the numbers are 1, 2, 3, 4 and 6. What is there in between the arches on the inner aspect that is endodermally lined, that is called as pouch. In between the arches that is lined by ectoderm or covered by ectoderm is called as cleft. So how many clefts and pouches will be there in between 5 arches? That's the number. So first pouch, second pouch, third pouch, fourth pouch. Same way first, second, third and fourth cleft. So number is clear now. Now we come to the details of pharyngeal arches. Each pharyngeal arch, 5 of them, each pharyngeal arch will have these components as derivatives. There will be a skeletal element, there will be a striated muscle, there will be a artery, and there is a nerve of every arch. So what you see here, if we enlarge one particular pharyngeal arch, components are shown here within the mesoderm. Okay. So arch artery will be there. You have all learned development of arteries. Correct? Cardiovascular system, there are 6 lectures that were held. Out of which a sizable time was spent on development of arteries. Especially when you learn thorax, at that time that correlation had to be established. Aortic arch arteries. That's the name that was given. So that is corresponding to each of these pharyngeal arches. 6 aortic arch arteries, pairs, remember? The 5th one disappears. And there are derivatives and remnants of 1st, 2nd, 3rd, 4th and 6th on right and left hand side. Do you remember this? So same thing, same artery is here. So if this is 2nd arch, then there will be a remnant of that 2nd aortic arch artery that will form the artery here. Same way, the mesoderm here will have a cartilage. That's called as the cartilage of that particular arch. That will give rise to some structure, skeletal element. Then there will be a nerve that will reach the arch. Because nerve is developing from which germ layer? Ectoderm. So it has to migrate and reach there. Okay, so nerve of the arch. Artery, nerve, and mesoderm has cartilage, and remaining mesoderm will give rise to the muscle, striated muscle. Remember, when you learnt derivatives of neural crest cells, two derivatives are muscles and cartilage of pharyngeal arches in one of the medical colleges. Correct? Muscles and cartilage of pharyngeal arches. So, if we write only muscles and cartilage develop from neural crest cells, it's an incomplete answer. It is muscles and cartilages of pharyngeal arches. That's the complete answer. So, this is that muscle, striated muscle. So, then comes the question, what does neural crest do? The neural crest, which has developed on the dorsal and lateral aspect from the neural tube, it has pinched off. Those cells are free to move around any part of the body. So, they migrate. So, they migrate in the head neck region, they migrate to the thorax, they migrate to the abdomen, they migrate here and there everywhere. As they migrate, they induce the mesoderm of the pharyngeal arches to form the structures. So much so that because neural crest derived from ectoderm induces the mesoderm of the pharyngeal arches. In fact, the mesoderm is referred to by some authorities as mesectoderm, because it is neural crest that induces development. So, these four elements, got it? Now, let us see some general principles and then go to the specifics. So, you got these four elements always are derivatives of each pharyngeal arch. So, what happens to the skeletal elements? Neural crest cells from the cartilaginous rod in the substance of pharyngeal arch. From it is formed. Now, what are the fate of these cartilages? Some part may persist, some part disappears, some part is converted into bone. Actually, the word conversion also is not correct. When we say endochondral ossification, it is replacement of cartilage by bone. When we say intramembranous ossification, it is replacement of the mesenchymal cells directly by bone cells. So, it is actually not conversion. The word is very loosely used, but actually some part is replaced by bone. And some part of the perichondrium of the cartilage persists as ligament. Perichondrium is connective tissue. So, it will continue to form ligaments of various parts of the head and neck. So, this is the fate of cartilages of pharyngeal arches. Either persist, disappear, replaced by bone, or persist as ligament. What happens to muscles? They differentiate into striated muscles, they migrate from the site of development, gain attachment elsewhere for functional purposes, and during migration what happens is they carry their nerve with it. It is important, each of the points is important, because there are certain muscles that develop in the head and neck, but they migrate for functional purposes elsewhere, but they carry the nerve with it. Give example. Now, one is diaphragm. They may not be directly related to pharyngeal arches, but diaphragm develops in the head and neck, but descends down to the thorax, junction between thorax and abdomen, but carries the nerve with it. So, phrenic nerve supplies diaphragm. Then coming to the nerves of the pharyngeal arches. Pharyngeal arches, because of their location, they are very close to the hindbrain. So, therefore, from the hindbrain vesicle, whichever nerves are there, they are going to supply derivatives of the pharyngeal arches. Each nerve appears at the dorsal end of the cleft and divides into two branches. So, there is another term now, trema. Till 12th standard, you must have learned helicotrema, internal ear cochlea, shell shaped. So, that turns together is like a helix. So, it is called as helicotrema, correct? So, trema is a cleft, is a groove. So, therefore, a branch of the nerve cranial to it is pre-trematic branch. The branch of the nerve caudal to it, caudal to the trema, that is cleft, is called as post-trematic branch. So, each pharyngeal arch nerve will have pre-tematic and post-tematic branches. That's what is the statement here. Pre-tematic branch supplies the arch cranial to the cleft, and post-tematic supplies the supplies the part caudal to the cleft. Pre-tematic nerve of all arches generally degenerate except the first arch. Pre-tematic nerve of the first arch forms this nerve, chorda tympani nerve. Have you heard this term? Chorda tympani. Facial nerve you have learned, no? One of the branches of facial nerve is chorda tympani nerve. You will be actually visualizing it when you dissect an area called as infratemporal fossa. Chorda tympani nerve. By any chance do you remember, anyone remembers, through which foramen chorda tympani nerve comes out? No. Stylomastoid foramen, facial nerve itself comes out. Before the facial nerve emerges, chorda tympani nerve is given off. So it has to have another foramen of exit. Okay. You know what is petrotympanic fissure, petrosquamous fissure, tegment tympani, dividing it into some parts. You know what is spinosphenoid? Spinosphenoid has got two nerves related to it. One going medial to it and one going lateral to it. Any idea of these two nerves? One is chorda tympani nerve, that's medial, and auriculotemporal nerve, that is lateral. So chorda tympani nerve emerges from that petrotympanic fissure. The nerve to the arch is a mixed nerve, and it supplies muscles derived from the arch and as well as carries sensations from the areas that are derived from the pouches and clefts. So these are general features which will apply to all the arches with some modifications here and there. Arteries of the arches. Each arch contains one arch artery. These connect the dorsal aorta with the aortic sac that lies ventrally, and aortic arches modify and form the arteries. So general statements pertaining to arteries. So if you have understood these general statements, now is the time when we are going to list the structures. Coming to the first arch. Skeletal elements are these two bones which are middle ear ossicles, malleus and incus. Maxilla, zygomatic, squamous part of temporal bone and mandible. These are other bones that are. Ligaments are anterior ligament of malleus, phenomandibular ligament. You are familiar with these terms, but you have not learned details of these as yet. Let's try and understand this through images. This will give you clarity. So these are bars of the pharyngeal arches, mesoderm. This one is first. This is also a part of the first. This is second, this is third, and this is fourth. So reorganized to form these bones. You can see maxilla is there, then temporal bone is there, part of the zygomatic bone is there, then mandible is there. These are all parts of the first arch. Second arch, blue in color, you can see stapes, styloid process of the temporal bone, stylohyoid ligament, and then part of the hyoid bone. Upper part of the body of the hyoid bone and the lesser cornu or smaller cornu. Third arch, remainder of the hyoid bone. Fourth and sixth arch, cartilages of larynx. So this is the correlation. So this is how it starts developing, and this is the final product. This is another diagram to show you the derivatives of all the arches, skeletal derivatives of all the arches. Bilateral representation, you can see. So malleus, incus, then this is stapes. Stapes is from second arch, malleus, incus is from first arch. So these are all the derivatives from the first arch. Second arch, you can see here, S. Lesser is smaller, upper is smaller part. So all are derived with the or start with the letter S. Upper is superior part of the body of the hyoid. So all S's are second arch. A second arch also is S. Third arch, remainder of the hyoid bone. Fourth and sixth, cartilage of larynx except epiglottis. This is in words in tabular format, what we have seen in the picture. Third, fourth and sixth. So the only cartilage of larynx which is not derived from the fourth and sixth arch is epiglottis, because it has got a different source of development. Now coming to the muscles. Again there is a big list. But when you learn the gross anatomy subsequently, it's not very far away. Muscles of mastication. What is mastication? Chewing. For chewing, what has to move? Which bone has to move? Mandible. Very good. So muscles that move the mandible are referred to as muscles of mastication. And there are only 4 muscles that move the mandible. When you clench your teeth, the muscle becomes prominent here is masseter. When you clench your teeth, the muscles become prominent here is temporalis. So temporalis above, masseter below. And 2 pterygoids, medial and lateral pterygoid. So these 4 are muscles of mastication. When you dissect anterior triangle today, you will be able to see mylohyoid, anterior belly of digastric. And further deeper muscles are tensor tympani and tensor velar palatini. So 8 muscles are derived from first arch. Second arch, muscles of facial expression. You have already learned face and muscles of facial expression. Muscles of facial expression are actually, their side effects are facial expression, but their main effects are to, what are the functions of muscles of face? To protect the orifices that exist in the face, protect the sensory organs that are present in the face. That's the main function. So muscles of facial expression, posterior belly of digastric, stylohyoid and stapedius. These are derivatives of the second arch. Third arch, there is only one muscle that is derived. Stylopharyngeus. So naturally, when there is only one muscle derived, this will be a question for MCQ. The muscle derived from the third pharyngeal arches. The muscle supplied by the nerve of the third pharyngeal arches. Answer is same. The muscle supplied by glossopharyngeal nerve is stylopharyngeal, which is the nerve of the third arch. And fourth and sixth arch, all are the muscles of larynx, constrictors of pharynx, and striated muscles of esophagus. Nerve. First arch, the nerve is mandibular division of trigeminal nerve. So fifth nerve. Second arch, facial nerve, seventh nerve. Third arch, glossopharyngeal nerve, ninth nerve. Fourth and sixth arch, vagus nerve. Fourth arch particularly is superior laryngeal branch of vagus. Sixth arch specifically is recurrent laryngeal branch of vagus. Superior laryngeal, recurrent laryngeal. All this you will be seeing when you dissect this now, anterior triangle and deep structures of neck. So 5, 7, 9 and 10. Now having learnt functional components of cranial nerves before, you have learned this? Can you tell me cranial nerves 5, 7, 9 and 10? Based on their supply to muscles derived from pharyngeal arches, carry which component? Correct. Special visceral efferent or branchial efferent. So that's the correlation. So this is showing you the concept of pre-traumatic nerve and post-traumatic. So this is the cleft Before the cleft is pre-traumatic, after the cleft is post-traumatic. So pre-traumatic nerve of the first arch we said is chorda tympani nerve. Actually it's a branch of facial nerve. Facial nerve is a nerve of the second arch. But that pre-traumatic branch supplies structures derived from the first arch. Now, you haven't learned, but I'll tell you right now. Chorda tympani nerve. What is its role? Its role is to carry taste sensations from anterior 2/3 of the tongue. Taste sensations. Otherwise, logically, we have not learned development of tongue. Tongue is also supplied by a nerve called as lingual nerve. Lingual nerve, you will learn subsequently, the branch of mandibular nerve, which is the nerve of the first arch. So what does this give you an idea? That the tongue anterior 2/3 is derived from the first arch. That's why it's carrying sensations from the lingual nerve. But chorda tympani supplies or carries taste sensations from the tongue anterior 2/3 because it is a pre-traumatic branch of the first arch. You have heard these statements. Have you internalized it? Difficult. Tongue is a special sense organ. You will learn gross anatomically that there is an anterior 2/3 and posterior 1/3 of the tongue. Anterior 2/3 carries general sensations also and special sensations. Same for the posterior 1/3 also. General sensations are carried by lingual nerve, which is a branch of mandibular nerve, which is fifth cranial nerve, which is the first arch nerve. Chorda tympani is a branch of facial nerve, which is the second arch nerve. But chorda tympani is a pre-traumatic branch, so going in front of that first cleft. So it carries taste sensations from anterior 2/3 of the tongue, which is derived from the first arch. So this is the explanation for the same. Artery. First arch artery represents terminal branch of maxillary artery. You haven't learned maxillary artery terminal branches as yet. That you will learn when you dissect infratemporal fossa. Second arch, stapedial artery. Third arch, common carotid artery and the root of internal carotid artery. Fourth arch, on the left hand side, it gives rise to arch of aorta. Right fourth arch artery gives rise to right subclavian artery. Sixth arch artery forms roots of the definitive pulmonary artery and also part of the dorsal aorta. This is diagrammatic representation of the arteries. Okay. This is going to form subclavian artery on right side and arch of aorta on the left side. Sixth arch artery forms the pulmonary artery and ductus arteriosus. So much so about derivatives of pharyngeal arches. Shall I ask you a random question? Recall. Firstly, I will start with a simple question. The muscle derived from the third pharyngeal arch is? Very good. The muscles derived from the first pharyngeal arch are? And two tensors, tensor tympani and tensor veli palatini. Muscles derived from the second arch. Muscles of facial expression. Posterior belly of digastric. Stylohyoid. Stapedius. These are all derivatives of second arch. Very good. Specify the nerves of the four pharyngeal arches. First arch, mandibular nerve. Second arch, facial. Third arch, fourth arch. Superior laryngeal branch of vagus, sixth arch, recurrent laryngeal. We haven't thrown light on two terms yet. Cartilages of the arches. The first arch cartilage is called as Meckel's cartilage. The same Meckel who described Meckel's diverticulum. The same Meckel who described cavum trigeminale in the skull for the trigeminal ganglia. Meckel. So Meckel's cartilage does not give rise to the entire mandible, which is from the first arch. First arch cartilage is Meckel's cartilage. It only gives rise to some part between two foramina of the mandible. You will be seeing them today. Mandibular foramen and mental foramen. Between that, there is a canal, mandibular canal. That part is derived from the Meckel's cartilage. The second arch cartilage is called as Richard's cartilage. Not Richard, Richards. R-E-I-C-H-E-R-T. Richard's cartilage. Okay. So this is about pharyngeal arches. Now let's go to pharyngeal pouches and clefts. We know the location of the cleft and the pouch. The cleft is on the external aspect, so lined by ectoderm. Pouch is on the internal aspect, lined by endoderm. You can see few terms here which are listed in this. Tubotympanic recess. Tubotympanic recess. The name suggests that the derivative will be a tube and something related to tympanic membrane. The tube which is going to be related to the tympanic membrane is Eustachian tube. Very simple, very logical. So tubotympanic recess, which derived from the first pouch, is going to give rise to Eustachian tube and the middle ear cavity, which is bounded by the tympanic membrane here. The second pouch, the word seen here is palatine tonsil. You have seen or you have learned microanatomy of the palatine tonsil. In microanatomy of palatine tonsil, what did you see? Lymphoid nodule, which is surrounded by the mucosa of the pharynx, because palatine tonsil is located in the pharynx. So mucosa is lined by pseudo-stratified columnar epithelium, or stratified columnar epithelium, or stratified squamous epithelium. Which epithelium did you see in palatine tonsil? Stratified squamous non-keratinized epithelium, because that is the lining of the pharynx. Okay. So is epithelium derived from the pouch? Are the lymphocytes derived from the pouch? What is derived from the pouch, do you think? It is the epithelium that is lining the palatine tonsil that is derived from the second pharyngeal pouch. Lymphocytes, remember, are cells, blood cells. They are derived from which germ layer? Mesoderm. So when we say palatine tonsil is derived, it is the epithelium that surrounds the palatine tonsil. Third pouch, you can see that there is a dorsal part and a ventral part. Dorsal part gives rise to one pair of parathyroids. It's referred to as parathyroid 3 because third pouch gives rise to it. But this parathyroid will migrate down and become inferior parathyroid. There are two pairs of parathyroid glands, superior parathyroid and inferior parathyroid. Inferior parathyroid is also referred to as parathyroid 3 because it's derived from the third pouch. Why? Because thymus is also derived from the third pouch. Again, when we say thymus, thymus also contains lymphocytes. So, are the lymphocytes of thymus derived from the pouch? No. The epithelioid cells, the epithelio-reticular cells of the thymus are derived from third pouch. So, thymus, where is the thymus located? So, it's in the thorax. Correct? It's in the thorax. Larger structure first and then specific. Can it go into the anterior mediastinum? Now don't ask me what is anterior mediastinum. Superior and inferior mediastinum. Inferior is divided further into anterior, middle and posterior mediastinum. So superior has got direct communication with anterior mediastinum. Correct? So if thymus can reach up to superior mediastinum, it may also decide, okay, let me try anterior mediastinum. So it may reach there. That means from the neck, it migrates and reaches there. So as it migrates, the force is also going to carry the parathyroids with it. Parathyroids are left behind in the neck with the thyroid gland, and the thymus further continues its descent. Fourth pouch, there are two derivatives you are seeing here. Parathyroid 4, that is superior parathyroid. And then there is something called a lateral thyroid element. Lateral thyroid element, which forms the lateral part of the thyroid gland. So these are all derivatives of the pouches. This is a diagram to show you how they develop. So palatine tonsil, epithelium, tubotympanic recess, eustachian tube. Parathyroid 3 along with thymus. This goes here to inferior parathyroid. Parathyroid 4 remains here, superior parathyroid. Okay. And lateral thyroid element comes here and forms the lateral part of thyroid. These are all derivatives of pouches. Another diagram to show the same summary. Eustachian tube, middle ear cavity, palatine tonsil, inferior parathyroid, thymus, superior parathyroid and lateral thyroid element. These are all derivatives. And this is a summary in words. Okay, you have got a glance. Coming to the grooves, very simple. The lateral side of the neck, lateral aspect of the neck is very smooth. Correct? We don't have any defect which is seen here. Does anybody have any defect by any chance? No, na? It is smooth because of this. The first cleft gives rise to external acoustic meatus. External acoustic meatus. So from inside is eustachian tube, from outside it is external acoustic meatus, and both of them are going to meet or they are separated by tympanic membrane. Correct? So very simple to remember. Then what happens is that this part, everything overgrows. So the area, the second arch overgrows and hides the remaining clefts. The second arch overgrows the remaining clefts. That is what is shown here. The second, third and fourth cleft, they obliterate. Obliterate means they will disappear subsequently because of the overgrowth of the second arch, and that forms a smooth contour of the neck here. If there is something wrong that goes here, then the cleft will persist. If the cleft persists, there will be a defect seen on the lateral aspect of the neck. Suppose they don't completely disappear, then they remain like this, opening inside the neck, it remains. This is lined by epithelium, so it will start secreting. Fluid can get collected there. So this is sinus. It may open internally, it may open externally. Coming to the membranes. Only one membrane is important. The first pharyngeal membrane. What is that membrane? The junction between the cleft and the groove. So in this is the membrane. This gives rise to tympanic membrane. So tympanic membrane is tridermal in origin. Endoderm, mesoderm and ectoderm. All the three germ layers give rise to tympanic membrane.